Wonderful. So good afternoon and welcome to bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick, joined by my vice chair, Bonnie Collison, who's in the Senate right now presenting a bill, but she'll be right back. This is our first session back in person since 2020, so I ask for your patience if we encounter any technical and streaming issues, which we will sometimes. Please set your electronic devices to vibrate and don't hold conversations in the committee room while testimony is happening. If you have to have a conversation, please go outside. As a reminder, there's no food or drink allowed in the gallery because staff has to clean it, and it's not kind for them to do that. It's not their job. All bills that are Senate cross files of previously heard House bills will be sponsor only. And if they're in the same posture, just tell us it's in the same posture. If there's an amendment, let us know as well so staff can make a note. The committee will accept oral testimony on Senate bills from the bill sponsor, a sponsor's designee, or the representative of the department that requested the legislation. For Senate bills that do not have a House cross-file, we will hear from the bill sponsor, one witness in favor of the bill, and one witness opposed to the bill. That is it. The public may submit written testimony to indicate their position for the bill. We do read it. Please adhere to our usual committee rules for my fabulous committee of one question and one answer, and please keep your questions brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and YouTube. Today we will hear the bills in the following order. First, we're going to start with the fabulous Senator Vital, Senate Bill 184, followed by Senate Bill 678, followed by Senate Bill 349, Senate Bill 14, Senate Bill 202, Senate Bill 727, Senate Bill 728, and the final bill of the day is Senate Bill 731. We're going to start with Senator Vital, health insurance, diagnostic, and supplemental examinations for breast cancer cost sharing. Good afternoon. How are you, Senator?
I'm wonderful, Madam Chair, and to all the members of the committee, I'm back 3 days
in a row.
I love this committee.
Long time no see.
So thank you, Madam Chair, and members of the committee for hearing Senate Bill 184. I'm going to follow the chair's directions. This bill needs the amendment that you put on the House bill, House Bill 736. If you'll put the same amendment on the Senate bill, we'll be in the same posture, and I'll be happy.
Wonderful. Are there any questions for the senator? Seeing none, Senator, thank you for the wonderful testimony. This actually concludes the bill hearing on Senate Bill 184, followed by Senate Bill 678, health insurance reimbursement for services rendered by a pharmacist.
Thank you again, Madam Chair and members of the committee. This bill has a House cross-file of 1151. It passed 131-0 in the House, and it's in the same posture, and I would love to have your favorable report on Senate Bill 678.
We love that testimony. Are there any questions for the senator? Seeing none, this concludes the bill hearing on House Senate Bills 184 and Senate Bill 678. Thank you, Senator.
Thank you.
Next, we have the amazing Senator Washington, Senate Bill 349, State Board of Examiners of Psychologists, License and Registration, Issuance and Renewals, Electronic Means. How are you?
I'm good. Pleased to present Senate Bill 349. The State Board of Examiners would like to be able to issue licenses and certificates electronically. You've heard this bill. You've passed this bill. There are no amendments. It's in the exact same posture, so I ask for your favorable report.
Thank you. Are there any questions for Senator Washington? Seeing none, thank you, Senator Washington.
Right, thank you.
Great testimony. This concludes the Senate bill hearing for 349. We have the wonderful Senator Augustine, Senate Bill 14, Health Occupations, Clinical and Graduate Alcohol and Drug Counselors Licensure. How are you?
I'm great. Thank you, Madam Chair, members of the committee. Senator Malcolm Augustine with Senate Bill 14, which is in the exact same posture as House Bill 291, which was passed by this committee. I'd ask for a favorable report.
Thank you. Any questions for the senator? Seeing none, thank you for your wonderful testimony. Yes. Have a great day.
You too.
Wonderful. Is there someone here for Senator Feldman? Anyone here for Senator Feldman? Anyone here for the Chair of Finance from the department? Will you come up? Wonderful. So you have 3 bills, correct? Correct. So let's call you Senate Bill 727 first. That is State Board of Physical Therapy Examiner Sunset Extension. How are you?
Doing well, thank you.
Wonderful to see you.
Thank you again. My name is Megan Peters. I'm Acting Director of Governmental Affairs for the Maryland Department of Health, here today to testify in support of Senate Bill 727 as amended. This is a sunset bill and a departmental bill that extends the board's statutory and regulatory authority. As amended, the extension is for 2 years. MDH requested and supports these amendments. We are focused right now on ensuring that the boards are running smoothly, so our healthcare professionals are able to enter and remain in the workforce. And we believe a more thorough evaluation of the state's Health Occupations Board is needed at this time to assess ongoing concerns among the board's licensure, technology, and administrative functions. Therefore, MDH believes a 2-year sunset extension allows us ample time to examine these functions and return to the General Assembly in 2 years with an update. In closing, we request a favorable report on this bill.
And we have a virtual witness, right? She's in here? Okay. Ms. Ellis, good afternoon. Will you be so kind and give us your testimony, please? Tell us who you are and your testimony.
Thank you, Chair.
You're welcome.
Melnick and members of the Health and Government Affairs Committee. My name is Lori Kendall Ellis. I am the Executive Director for the State Board of Physical Therapy Examiners. And on behalf of the Board of Directors, we appreciate the opportunity to express our support for Senate Bill 727 with the amendment to extend for 10 years to July of 2034. Of significance is that the OLA auditors did not recommend sunsetting the board or shortening the sunset extension, nor were we named in the report. And as of January 5th, 2023, we received from IACS a favorable report that we have succeeded and finished and met all of the findings. And also due to our operational administrative duties that are constantly improving, we also do not have any backlog licenses or any other issues of concern with licensure application and renewal. And we are currently exploring upgrading licensure so we can continue to improve and expedite licensure for physical therapy practitioners. Also verified with the Office of Constituent Services, our board has received 0 complaints in fiscal year 2022 and fiscal year 2023. So being proven to be fiscally responsible and operationally sound, we would very much like to focus on our mission of protecting the public and would ask for you all to consider amending and favorably having us have a 10-year extension, as previously mentioned, till 2034. Thank you.
You're welcome. Very impressive testimony. Some boards can learn from you. It is truly refreshing. Are there any questions for these 2 witnesses? Seeing none, thank you both for your time today. I really appreciate it.
Thank you so much.
Thank you for being with us, and thank you for the work you do. Megan, may I ask you for a favor? Let me take Senator Feldman's bill, and then we're going to go back to your 2, okay? Thank you for being flexible. And this is this actually will conclude the bill hearing on Senate Bill 727, and we're going to go to Senate Bill 202, Senator Feldman, Prescription Drug Affordability Board Upper Payment Limits. How are you?
Good afternoon. I'm on. Thank you. Good afternoon, Chair Peña-Melnick and members of the House Government and Health and Government Operations Committee. My name is Frederica Struess, and I work for Senator Feldman. I'm here on his behalf, and he apologizes for not being here in person. He asked me to extend his regards to you all. Senator Feldman is the sponsor of Senate Bill 202, Prescription Drug Affordability Board Upper Payment Limits, which is cross-filed with House Bill 279. As you know, this emergency bill simply reinstates the provisions of the law that sunsetted on January 1st, 2023, and allows the Prescription Drug Affordability Board to continue their work. This committee voted the bill out on February 14th, and the full House voted successfully out on the 16th. The House and Senate bills are in the same posture, and therefore Senator Feldman respectfully requests a favorable vote on Senate Bill 202. Thank you so much for your consideration.
You're welcome. Are there any questions regarding Senate Bill 202? Seeing none, can you just give him a message for me?
I will.
Tell him that because he didn't come he owes me a key lime pie from Lunasis. It's very good.
Okay, I'm writing that down.
And he can deliver it to my office,
Is there
okay?
a deadline?
No,
date?
no deadline.
Okay.
Thank you. Before session ends. Thank you. Have a blessed day. This concludes the bill hearing on Senate Bill 202. Thank you. Megan, let's finish with the two bills you have. And we're going to call now Senate Bill 728, State Board of Examiners and Optometry Sunset Extension. And we have also a virtual witness. You may get started.
Thank you. Good afternoon again. Again, for the record, my name is Megan Peters, Acting Director of Governmental Affairs for the Maryland Department of Health. Similar to the previous bill, we are in support of SB 728 as amended, another sunset bill, a departmental bill that extends the authority of the Optometry Board. For 2 years, MDH requested and supports these amendments. Again, we believe 2 years is ample time for us to work with the board to assess their operations and licensure and functions and request a favorable report. Thank you.
Thank you. May we have the, yes, good afternoon, Ms. Joyner. How are you? You can unmute yourself and give us your testimony. We're not able to hear you. You want to speak? Let me see if I hear you. No. You want to go out and come back again? And we'll wait for you. No problem. You can, okay, she'll come back again. All right, Megan, you have to entertain us.
I didn't bring key lime pie.
How's your day going?
It's good.
Yeah?
It's nice and spring-like outside, so that's great.
We do not know, but we'll get to experience it in a few hours.
I hope so.
Yeah.
Yes.
We'll let her come back in.
Okay.
You have a lot of testimony in other committees?
This is it for today.
Okay.
Yeah.
Yeah. Did she come back in? She did? Okay, great. Thank you for your patience, okay? We'll make it work. I don't see her. Okay. Okay. Still cannot hear you. Can you check your audio settings? There's a little box that says audio. Yeah. Well, we can't hear you, but may I ask you, are you in support of the bill? Can you move your head for me? Are you in support of the bill? Can you hear me? You are. Can you give me a thumbs up? Do you support the bill? Okay, great. Thank you so much for your testimony, okay? We can't hear you. We try, but we know you support the bill, and Megan did an amazing job, okay? Thank you so much. You have a blessed day. Are there any questions for Megan? Seeing none, Megan? This concludes the bill hearing on House Bill 728. Now let's go to Senate Bill 731, Megan, and that is State Boards of Certification of Residential Child Care Program Professional Sunset Extension.
Okay. Good afternoon again. Final piece for me today. For the record, my name is Megan Peters, Acting Director of Governmental Affairs for the Maryland Department of Health. Here today to testify in support of Senate Bill 731 as amended. Again, this is a sunset bill, a departmental bill, and MDH requested amendments to a 2-year extension, and we support these amendments and the bill as amended. Again, MDH is focused on ensuring the boards are running smoothly, and we believe 2 years is ample time to complete this evaluation, and therefore request a favorable report from this committee. Thank you.
Thank you. Ms. Ham?
Yes. You ready for me?
Oh, we can hear you, yes. How are you?
I'm fine, thank you. Good afternoon, Madam Chair and members of the committee. Thank you for allowing me to testify before you today. My name is Darlene Ham, and I am the Executive Director for the State Board for the Certification of Residential Child Care Program Professionals. I am here today in support of Senate Bill 31 with amendments. This bill seeks to continue the State Board for the Certification of Residential Child Care Program Professionals in accordance with the Sunset Law by extending the board's existence to July 1st, 2034. The passing of this bill will ensure the continuation of the board's mission to protect the children living in Maryland residential child care programs and to promote quality care of the field of residential child care. The State Board is the certification authority for residential child care program professionals, administrators, and residential child care practitioners. This board has dealt with several challenges during the COVID-19 pandemic, as well as the MDH cyber network security incident attack. And the board continued to deliver the services for our certified program professionals and potential new applicants with very limited delay in the services. The board has no outstanding licenses, renewals, or complaints. The board complies with all audit requests and works diligently with the auditors to provide documents and anything else required to meet the standards. Therefore, it is crucial for this bill to pass in order to protect children living in residential programs who are among the most vulnerable individuals in the state. This board supports Senate Bill 31 with amendments to the existing year of July 1st, 2025 through July 1st, 2034. Amending the term for 10 years will allow the board to achieve success in fulfilling its mission and meeting key milestones. Thank you for the consideration of this legislation. Thank you. For this reason, we ask for a favorable vote.
Thank you for your testimony. Are there any questions for these two witnesses? Seeing none, thank you both for your efforts and your work, okay? Have a great day. This actually concludes, thank you, the bill hearing on Senate Bill 731. So for the committee, we're done with our bill hearings, but we're going to vote in about 5 minutes. We have, I think, 30 bills to vote on. Some of them were bills that we already had. So Michelle has put together the files. I went and peeked and looked at it with your names on it. If you could read them and learn them as well, right? Because you're going to be responsible for them. Also remember that on second reader and third reader now, there tends to be a lot of questions because we're getting closer to the end. And also make sure that you call the LA either on their cell phone or have the person call before that bill goes up, okay? So pay attention on the computer. But you will get questions, even when you didn't get questions the first time, okay? And for those of you that are the committee, subcommittee chairs, remember that you're backup. So also pay attention when the bill is called, all right? Make sure the person is at their seat. Yes. So we're going to wait. If you could give me 5 minutes. Yes. That's right, that's right. So just wait until that last, like if you're paying attention to the computer, if you don't have yours, like your next door neighbor's computer, if you look at, just make sure that the person is done with that bill and make sure you call. But, you know, like, don't assume that there are not going to be questions. I'm telling you, because we're close to the end, there will be questions on things.